Hi, Dr. Harris. Thank you very much for being here today.
Thanks for having me.
No problem. So today we're here to talk about a topic that has been dear to my heart, that I've been working on for the past 2 decades, which is about the dissemination of pathogens. Healthcare-acquired infections, commonly known as HAIs, has been a challenge for very many countries, including the United States. This coupled with the emergence of strains that are now becoming more and more resistant to antibiotics should make the issue of HAIs a matter of national emergency. Let me take, for example, Clostridium difficile, commonly known as C. diff. C. diff is a pathogen that infects more than 500,000 Americans every year. The mortality ranges from 6 to 30%. I mean, think about it for a second. Out of 100 people catching C. diff, 6 to 30 of those people will be expected to die. I mean, it's very, very unfortunate to think that someone would go in a healthcare facility to get a treatment and would catch a deadly disease such as C. diff.
This is an unfortunate situation. I mean, we really don't think that there's a silver bullet that's the answer. There's not a one solution answer. However, I'm a firm believer that simple and cost-effective solutions can have a tremendous effect on creating safe environments for patients and healthcare staff. We talked about C. diff earlier, which is a superbug. It's resistant to antibiotics and it's difficult to disinfect. So for patients, pharmaceuticals are working towards a vaccine. However, we're not there yet. And so it's critical to be cognizant of 3 things. The first thing is that C. diff is transmitted through the fecal-oral route, and it may be from direct contact with contaminated surfaces. It could be transferred from healthcare staff, from patient to healthcare staff to another patient, or from a surface to a healthcare staff to another patient, multiple ways there. And then the third one is inadequate hygiene. So a lot of people think that the alcohol-based hand sanitizers is the one-stop shop for everything they need for disinfection, but in fact that won't have an effect on C. diff at all. It's not effective, and you really have to wash your hands with good old soap and water to remove those spores from your hands. So we've been able to demonstrate that C. diff will migrate from space to space and from object to object and from person to person. A non-C. diff patient can acquire C. diff because of this migration effect. And, we know that it survives for up to 6 months on surfaces, and that's a long time for a pathogen to hang around to wreak havoc.
Well, thank you so much, Dr. Harris. So we've talked extensively about C. diff, but I think it is also worth mentioning that there are other body fluid transmitted infections, such as VRE or the norovirus.
That's correct.
I would also like to point out that so we are in 2025, and the dominant protocol for the management of bodily waste is still through the use of collection containers. So I brought here a standard bedpan, right, and a commode pail. So those 2 items are the most common containers used in healthcare facilities for the collection of body waste. So just picture it for a second. A patient will perform body function, and then a nurse or nurse aide will come, retrieve the collection container, go to the patient bathroom, dump it out really quick, and then rinse it out for later use. I mean, think about it for a second. Since the Industrial Revolution, there has been countless inventions and improvements made in the medical field, but body waste management has remained the exact same thing for centuries.
Yeah.
It's just crazy. So we've here an integrated system for the collection of body waste. We have pathogens that tend to move around, you know, like you stated earlier, and those pathogens tend to survive in the open, sometimes for months. So one could say, okay, all right, I understand, but why don't you bleach the why don't you bleach the patient room? That should do it. What's your opinion on the matter?
Well, I mean, bleach is the most widely used cleaner for C. diff in particular. You know, different pathogens require different disinfectants. So, but C. diff is usually, you know, bleach has been the hard and fast rule. There are newer opportunities and products to use. Hydrogen peroxide can be used for C. diff, as can some other mixtures that are out there that use a combination of things that might be less corrosive to the materials in the room, which, you know, impacts the longevity of those environments before they have to be replaced, that kind of thing. You know, I think that there's other technologies, might include UV lights. You know, everything has a pro and con for whatever the choice is that you make. Bleach is corrosive. UV light has to hit the pathogen in order to kill it. So if there's anything blocking the light, that will negate being able to kill the pathogens that's living in the shadows. So all of those things to say that there's not a foolproof, fast solution for decontaminating those environments. And, you know, the process of a bodily function or removal of bodily waste is going to re-aerate, right, the spores. So there's going to be a certain amount of contaminants flying around that space that have not been removed by bleach or anything else.
So we've talked about the most common practice for the management of body waste, what I personally call the good old manual cleaning of collection containers. Obviously, it is a messy business. It leads to the contamination of the surrounding. It poses a hazard to the patient. But one thing that we have yet to touch on, so to speak, is the physical and the mental impact that this practice has on frontline workers, so nurses, aide, and EVS. So now nobody will argue with the fact that patient and patient outcome should be front and center. But I don't think that this should be done at the expense of the people actually delivering the care to that patient. My opinion on it is that if the staff feels overwhelmed or neglected, it will have a detrimental impact on the quality of care of the patient and the patient outcome. So now, Dr. Harris, you have conducted a national survey to determine the perception of the current practices and the staff safety. Can you please tell us more about this study, the genesis, the findings, and the conclusions that you drew from it?
So the research question for our study really centered on occupational risk and the risk to nurses and to other healthcare staff from managing patient body waste. So we were really trying to put some attention to this because needle stick injuries get a lot of attention and a lot of a lot of effort to try and contain those risks and protocols for when that happens. But, we don't really hear people talking about this particular issue. And we wanted to understand how often staff were exposed to body waste, what their knowledge about that process, what their risks are, and what their risk of exposure is, and also, how they're affected by that exposure, potential illness, but also, how that impacts morale of nurses working in an environment like that and other healthcare people. So that was really largely the research questions that started this whole thing.
Okay, so sounds like an interesting study. So what I like about the aim of the survey is that it's pretty novel. Usually this kind of survey, this kind of study really center on the patient, focuses on infection control, with the before and the after. But here we have a survey that is focusing exclusively on the healthcare staff to try to understand their daily reality when it comes to body waste management. Is that correct?
Yeah, that's correct. I believe that healthcare staff, similar to what you said a while ago, like without good healthcare staff, that impacts quality of care for patients. And so the best way to really have good patient care is to take good care of the caregivers. We conducted a nationwide survey, and the results were quite revealing, at times even concerning. The survey findings indicated that 94% of respondents consider the management of body waste to be very important, compared to 86% who expressed deep concern about the risk of needle sticks, which was surprising to me. Additionally, when asked more specifically, 73% highlighted the importance of preventing skin exposure to body waste, and 83% identified exposure to the eyes, nose, or mouth as a serious problem. So there's a consensus among healthcare professionals that body waste management is an important factor that concerns them. And yes, our study showed that total number of needle stick injuries experienced by these participants in our study in the last 3 months was only 19, whereas the total number of exposure to body waste in the last 3 months was 178. So that's a 1 in 9 ratio in terms of the number of needle sticks to body waste exposures. So I found that to be remarkable.
So here we have frontline workers who know the risks associated with body waste management and the importance of preventing exposure. But the reality is that exposure is pretty frequent. Actually, 9 times more frequent than the dreaded needle stick. I mean, it's an incredible number. So now one could say again that, hey, you know what? The best way to prevent that exposure in the first place would just be to wear a full set of personal protective equipment, PPEs. Dr. Harris, do you have data to support that?
Yes. One of the most interesting findings was the lack of appropriate PPE being worn by the nurses. On one hand, the respondents seemed to not acknowledge the importance of PPE, but on the other hand, they weren't wearing it most of the time. Most in the survey said they would wear gloves, but that was about it. About half stated they wore gowns or masks. So, it's important to understand that you can wear gloves and gowns and that'll help protect your skin, but you really need eye protection and masks in order to protect your eyes, nose, and mouth. The overwhelming majority of the nurses stated that having a solution in place for the safe management of body waste would improve the quality of patient care, but it would also improve their dignity and morale.
So to summarize, I wrote it down here. So the consensus is that body waste management is important. The floor staff are as concerned about exposure to body waste as they are about needle stick.
At least.
And the frequency of exposure is pretty high. And gloves are often the only barrier between the healthcare worker and body waste. Is that right?
That's right.
Okay, then, so what about the staff reporting their exposure to body waste?
Well, it was pretty interesting. The majority of respondents felt that even though their facilities had protocols in place for reporting, that they were not likely to report an incident. I think about 84 of respondents who experienced exposure to body waste in their eyes, nose, or mouth never reported it. And less than 5% of respondents said that they would report such an incident.
Wow. Okay,
Yeah.
so why do you think that is?
That's a great question. Why would individuals who are directly exposed to body waste, splashes, and spills, and understand the risks that they're under for their personal safety, choose not to report an incident to management? First of all, we posed that question in two different ways. First of all, 2/3 of the respondents felt like they would have to justify to management why the incident occurred. And, you know, to me, that indicates a lack of trust between the healthcare worker and the management. And so that's one consideration. And the second one, 81% of respondents stated that repeated exposures make them desensitized, like they just don't react to it anymore. And that's like the worst place you can be when you're considering your personal safety.
Wow, so that is pretty conflicted information here.
Mm-hmm.
So on the one hand, the staff acknowledges the risk involved with body waste management. We've talked about that extensively. They want protection, but on the other hand, their behavior is contradictory.
Yeah. Yeah, it's interesting because I would simply say that for staff persons, they're going to prioritize their risk against whatever their job entails, like all of the things that they're doing every day. They may have, you know, 6 patients they're in charge of, and they're in and out of places. And the idea of donning and doffing all this gear every single time and then replacing it with the next one, like at some point they do become desensitized. And you know, it's almost like a splash and a spill of bodily waste isn't a problem until it happens to them and it becomes their problem.
Okay, so nurses have no choice but to unwillingly cut corners or to sometimes ignore their own safety. But this can only last for so long. I mean, like, everybody has a breaking point, and when that point is reached, that's when something or someone breaks. I have here a statement from a nurse that summarizes very well the expectation put on the healthcare workers.
Mm-hmm. Yes, please make sure you answer the call bell right away and serve tea or coffee or assist to the bathroom, whatever the patient needs. And don't let the patient fall or be dissatisfied with their stay. Oh, and the nurse is supposed to give meds, change dressing, coordinate care, chart every body function, turn the patients, get the bedbound ones in a chair, check vitals, hang IVs, and get to know the patient so you can tell if they have a changing condition. And stop and answer every doctor's question, every resident, therapist, and family member. And if it's C. diff, wash your hands with soap and water and use gown, gloves, and perhaps face shield every time you enter the room, even if it is to ask, how is your pain?
Registered nurse staff turnover has been really high, not as bad as right after the pandemic. But I mean, we of course cannot blame it all on body waste management, right?
No.
That would not be fair. But I think it's really important to note that one of the main reasons given by a nurse for leaving a facility is unresolved moral distress. Mm-hmm. All right. I also want to point out that the current situation with staff turnover is only a taste of what's about to come. The American Association of Colleges of Nursing found out in a recent survey that the median age of a registered nurse is 46 years old, and a quarter of the respondents to that survey stated that they plan to either retire or quit the profession at once within the next 5 years. So, and the reason cited for making such a decision were burnout, stress, and nearing retirement. Those were the key factors.
Sure. So those numbers are very concerning, and healthcare organizations need to be looking at, incentives and programs for recruiting and retaining good nurses. I think it's a challenge that we've had here in the United States for a very long time. And there's always a need for more nurses everywhere you go. And, but back to our own findings, here's some key actions that organizations can take based on the findings. So, focus on preventing staff from becoming desensitized to risk exposure. Employ educational opportunities. Maybe it's some educational posters, or maybe some quick courses, or something that goes out to all the email, like an email blast, that can help remind people to take good care of themselves as a priority. Another one would be repeating of donning and doffing of PPE while emptying bedpans or commode pails, in addition to their other duties, may not be the right solution. Being able to implement strategies that limit exposure alongside appropriate PPE, that helps protect the healthcare staff and reduces the financial risks associated with occupational illnesses. So if you keep your nurses healthy, then that's very good for the organization and for the nurses themselves. Another thing is to explore cost-effective and user-friendly solutions for the collection, transport, and disposal of body fluids. Replacing a nurse, I think you mentioned this a while ago, maybe it costs $52,000 just to replace the nurse. Each C. diff infection ranges from $20,000 to $40,000 per incident. So that's a lot of money going out of an organization that's there to provide health care, right? So investing in these type of solutions is undoubtedly beneficial to that organization, the healthcare staff, and the patients.
If you could leave the audience with one key takeaway from the study, what would it be?
I think organizations should learn about the options that are available to them and consider that the cost of implementing a novel strategy may offset the financial burden of HAIs and occupational illness. Protocols to minimize risk of occupational illness will improve the well-being and safety of frontline healthcare workers, and then that makes them in a better place to provide good quality healthcare.
Well, thank you so much, Dr. Harris, for sharing your findings about the striking reality of those frontline workers. We've learned a lot today, and one thing that I hope the most is that the community at large will take notice of those findings and will act upon them. Again, those frontline workers, they are needed. We've talked about it extensively. They care for the patients, and we should not forget to care for them.
Yeah.
Thank you. Thank you so much.
Thanks for having me.